Hello and welcome back. We're excited to be in another session of FestiHealth and have the first guest speaker that actually opened the first FestiHealth from China, Dr. Ewelina Biskup, who is in Shanghai right now. She's a doctor of internal medicine from Switzerland, currently practicing in the Shanghai University of Medicine and Health Sciences. She's both a practicing physician, but also on faculty, teaching and doing research. And we'll have a beautiful perspective from Ewelina, and really excited to have you opening the conference with us together because of your unique perspective, because you were actually in China almost from the very beginning. You actually, when the whole thing started, you actually flew to the United States, and then were called back to basically help with everything in China, and went through the thick of things in the first wave of COVID in China. So first of all, welcome, Ewelina. It's a pleasure to have you.
Thank you very much. It's a pleasure to be back on after some technical problems at the beginning.
That's excellent. So, we are definitely beyond the technical problems. We had a wonderful FestiHealth. It succeeded beyond any expectation that anybody else had when we started. So we're working on the next one. So it's a great timing to actually have a conversation with you, because COVID has evolved since then, and then actually the insight will be very relevant a week, just a few days after Beijing elevated the alert level to number 2, and going back into being concerned about the spread of COVID-19. So I think that timing-wise, we're a great timing. And I want to start basically by saying that you are a board-certified physician in internal medicine, doing research focusing on oncology and longevity, but also in AI and biomarker, which is a combination that places you at a crossroads between traditional and clinical patient care, and also innovation and all kinds of technologies that are on the cutting edge, revolutionizing healthcare in many ways. In that context, what are your observations and predictions based on your experience related to the pandemics? And I want to really think about it through the lens of somebody that's seen the trajectory happening in China, but also evolving everywhere in the West, in Europe, where you're from, and also in the United States.
Mm-hmm. Well, thank you very much. It's a fantastic question. Indeed, it is very hard to bring it into one sentence because there were so many changes and so many developments that happened and that were perpetuated by COVID. Of course, most of them were really positive for biotechnology and for advancing healthcare and medicine in general as science and as patient care. Well, first of all, here in China, there have always been measures and steps towards precision medicine, towards developing medicine to another level, targeted medicine, and bringing it really to the patient. That was one of my motivators to be here in China always, especially in Shanghai. There are tremendous initiatives and projects and beautiful collaborations between hospitals and biotech and pharma companies, AI companies, and so on. And on that level, on the top of that, the extreme speed and pace of COVID came and really accelerated everything to the level that we now have much more AI implemented in the hospital, much more drug development based on machine learning implemented in projects of the government and so on. So maybe for the non-physicians, I can only say, how can you see it as a patient? Basically, for example, in China, during the COVID time, we did not really have lowering of the number of patients in the hospital, in the big hospitals, but of course in the provincial hospitals we did. So how did we address that? With AI. Telemedicine was booming. And I know it was also developed in other countries. Israel did fantastic thing. Even countries that are maybe not that well developed technologically, like Tunisia, reached out and asked for experience. So that was something. Switzerland did tremendous things. So many countries definitely accelerated telemedicine. Point. The most fascinating, or the two most fascinating aspects, however, for me were, number one, that people, and especially pharma and also hospitals, realized that drug development can be done in a much cheaper and a much faster way if we implement AI and machine learning. So there were fantastic efforts, good publications, great, absolutely great and fantastic work that was done. For example, in like developing drugs from the scratch, we call it in silico. In silico medicine does it, for example. So and another thing was the amazing solidarity among scientists in overall, and creation of global consortia. And that was something that I admired a lot. I'm very blessed that I was, or I am still, a part of some of them, really global, some from all continents. And what is very important is that we started to learn how to talk to each other. Mathematicians, computer science people, immunologists, physicians, and economists. We talk very different languages, and we started to talk to each other. We actually started to give lessons to each other, lectures every week, just to learn what we are doing and to communicate to find solutions for COVID.
Excellent. So, and you're talking about implementation on AI on the research side of the equation, on drug development and others, which is super interesting. Tell us a little bit about this, the same thing in the context of population health management. So we see the graph, if you look at the graph in Wuhan and then throughout China as a whole, and you compare it to some of the trajectories in the West, we see that there's a good job done there in certain levels. And once again, we're seeing the recurrence of similar trends right now, once again, and particularly as we're approaching, the winter pretty rapidly. What can we learn from some of these experiences, and what is done, which you think is effective, and what can we learn from a population health management perspective?
Mm-hmm. I think, well, there are several aspects to that, and I think we have many lessons that were learned, and first of all, we have results. So we have seen what works, and what works where, because it's geospatially very different, and the populations are different, measures that can be implemented are different. I can probably speak about China most flexibly because I have been here, I've experienced it, and as you mentioned at the beginning, unfortunately, we are seeing some, not new waves, but we see some cases that are not really reoccurring, but are new, and are most surely related to import. So opening the borders is again being put into the question, which is just, of course, horrifying effects, and we all want them to be open as soon as possible. So what China has done before, immediately when COVID was starting, was extreme prevention on every level, public health level and personal health level. Mm-hmm. So beyond masks and sterilization, temperature checks, pretty much everywhere, empowering, not forcing, but empowering social distancing, and very, very good tracking. So we have our apps, we are being tracked, and we embrace it. This is something positive. I would like to underline that. And this tracing is then immediately also used. So for example, we know that there was an accumulation of people in Beijing that were around the person that was infected. Everybody got tested, all the places they went to and people they encountered. It was done with an interview and tracing, were also interviewed, checked, traced, and people around them. So it's a combination. It's not only enough to track people with the app. You actually have to have some measures following after, and China has it, and all the tests are for free, so everybody can be tested. We are now, for example, using both the PCR and the swab test, so blood and swab together, to avoid the false negatives or all false positives, something that we learned as well. And almost all labs in the hospitals are certified to test for COVID. So, you know, at the beginning in January, we always had to send it to the central lab. So it caused delays. And this mistake, well, this problem was also repeated in many countries in Europe and so on. So, yeah.
So there's also use of artificial intelligence to try to in contact tracing and things like that.
Absolutely. Absolutely, 100%. AI is helping not only to track, but also to identify the patterns, how COVID might be spreading, patterns where we are trying, or the governments, the AI specialists, it's not me personally, but there are efforts to identify who is a super spreader, who is not a spreader, and to identify how many times one has to be checked. So for example, people are not really quarantined anymore because we have that good tests. So a huge difference already to what we had in January and February.
So that actually affects the fact that there's good testing and it's prevalent, actually affects the no need for quarantine, basically.
And the daily life, because if we didn't have it all, we would probably see again shops closing, bars closing, restaurants closing, businesses closing, offices closing. And we do not have that because there is such a huge amount of work being done in the background.
That's great. And another thing that is very interesting is that related to your research and the work that you're doing is the relationship between COVID-19 and aging. And not necessarily the real age of people, but actually, things that are related to aging that are independent of how many years you live your life. And so we heard a lot about the fact that the virus, prefers or tends to be more successful among people who are older. But also we heard about a lot of impact on people with comorbidities, with particular conditions. And now with all the, social, unrest and movement, we're talking a lot about the social determinants of health and the fact that it actually attacks people that are less privileged and have less access to healthcare as well. It'd be interesting to hear your perspective on that, because I know that you did a lot of work in aging. So, what do you see there in kind of the relationship between COVID in particular and this whole notion of health and well-being in the context of age?
Well, it's a fantastic question. Thank you so much, Ron. And it's exactly the brilliant observation that age is not only the number that we see on our passport, it's not only the chronological age that we should refer to when we are talking about aging. And I have to refer at the very beginning of the COVID pandemic, there was a major publication that whoever is interested, I can refer to, talking and exploring and explaining very well that actually the biological age is what we should look at, how really the person, what's really the person's age based on it, on his or her biology and different aging markers, as we call it. So there is a big boom in the aging research on biological markers, and there are fantastic scientists working on that as well, from Oxford, from in silico medicine. And actually this publication of Alex Javoronkov says that we should look at infectious diseases like COVID and pandemics as so-called gerolavic. So really infections that are affecting people that are aged in a biological sense. Now, biological age is determined on our heart age, on our cellular age, on our metabolomics, on microbiome, and so on. There is plenty of algorithms and still developing. And as you mentioned, we see in the statistics that, of course, people who are 70, 80 and older experience severe illness and had higher mortality. However, when we look then at the comorbidities, and they were also related to severe illness and mortality, we see especially those comorbidities who are biologically and immunologically connected to senescence or to aging, were those who were actually the most prominent. So say diabetes, cancer, autoimmunological diseases. So those people were most surely older than their chronological age. And there are projects that are now quantifying and objectifying that.
Yep, excellent. So that's fascinating. So let's say, so there's obviously something to look at that is beyond just the age itself, but like the state of people and how susceptible it makes them to get infectious disease like this, and also the interplay between the two that accelerates certain conditions and creates a lot higher risk. And talking about risk, let's talk a little bit about the future. So, we're getting into the summer. Everybody kind of expected that we're going to have like a virus holiday for a few months. And I talked with a bunch of infectious disease specialists, and they hoped that just like the flu, we're going to have a little bit of a hiatus with COVID. It doesn't seem like it if you look at numbers. Not some places in the world, yes, but maybe in China. But we're seeing that even in China, there's some spikes in certain places, like in Beijing. We're definitely seeing it in some places in Europe. We're definitely seeing it in some places in the United States. And with the eye to the future, to the winter that is coming up soon, it'd be very interesting to hear about prevention. Right, so like thinking about what we've learned, thinking about what we understand much better, right? Thinking about certain things that worked and certain things that didn't work, particularly from your perspective from China. What can you say about prevention? What can you share with us and help everybody think about how to prepare for the next big wave of COVID?
Yes, so let's hope that the big wave will not come, but indeed, I'm still a little bit pessimistic about vacation and the winter, but I'm very happy to be proven wrong and experience a surprise. In terms of prevention, I think there are two aspects. One is the public health preventional measures. So whatever we can do to actually avoid being exposed to people that might be infected is really working. And those are very basics. However, these basics were those actions that helped most in China. So really the very simple things like wearing masks, keeping away from other people, especially in crowded places, and washing hands and so on. Sterilization, avoiding hospitals, this really works. Now, not to the extreme, of course, of quarantine, hopefully, but we know that if we start with this prevention very early on, then we can avoid the quarantine. This is what we are seeing right now in Shanghai and other places. The other thing is we still do not have any, every patient, everybody is wishing that there will be a pill that you can take every day or once, or an injection or a vaccine, whatever, and someone will be protected. So we are far from that, and I don't think we will have it in this decade. But prevention in terms of lifestyle is extremely important. It's the hardest, I guess, because actually one has to work for it. But
so what is it? What is it that we need to do, both from an individual perspective and also from a public health perspective?
Yes.
Be specific.
Specifically from the personal perspective, from individual perspective, is boosting immunity. So lifestyle changes, proper diet, vitamins, if necessary, supplements. Sports, fitness is very important, even if it's just a very small thing, because we know that, for example, the muscle health and not necessarily building up, but at least preserving muscle mass is very important for our immunological system. So that's number one, all the typical lifestyle implementations. From the public health perspective, it is very important. So I don't want to make recommendations for the governments, but I can say that what worked very well in China is really to make the tests available to everybody, explain very, very nicely, and so that everybody can understand what's going on to everybody, avoid panic, and make people prone to those prevention measures. So so that everybody embraces it and shows solidarity. This is what happened in China for sure. Everybody wanted to be a part of the tracking system of the mask wearing. There's solidarity. Everybody understands that if we work collectively together in the public health efforts of the government, then we will be back to our lives, at least as much as possible, back again. And this is what happened. So this is a fact.
Yes, absolutely. And I think that on this particular note, you started with like global solidarity and the collaboration among scientists and researchers and working together, and you ended up with some advice for individuals and for public health officials and government about how solidarity among people in a population, in a community can contribute significantly to prevention and to actually getting less of an impact from the virus staying with us going forward. It was really fascinating to hear your experience and to get your advice. And it was a delight to have you with us and be part of the FestiHealth community. I'm looking forward to seeing you in the next FestiHealth. Collaborating with us. Keep doing the great work that you're doing in China, and stay healthy, most important.
Thank you very much. Thank you very much. Let me please just say thank you so much for FestiHealth and for what you are doing. I think it's an amazing opportunity for everyone, for scientists, for physicians, and for everybody else. So I had amazing and great feedback. We had participants from China, and we will definitely continue to have them. Thank you so much for your great work.
Absolutely. We're all in this together. Thank you, Ewa. Take care.
Take care.
Goodbye.